Hello everyone, welcome to my Healing Around the World project. My name is Dr. Alice Fong, and today I have the pleasure of introducing Dr. Monet Ouwinga, also known as Dr. O, here in Dunkirk, Maryland. She recently opened up a private practice with her partner Travis called OT Family Medicine. Please welcome Dr. Ouwinga. How are you doing, Dr. O?
I am doing well, thank you.
Oh, wonderful. Great. So tell me a little more about what got you into medicine.
I honestly have to tell you, I don't remember.
Okay, that's fine.
My mother will tell you that since the age of 6, I said I wanted to be a doctor, and I have maintained that path till this day.
Wonderful, great. And so what kinds of conditions do you see and treat?
I was fortunate to have extensive training in my residency. I trained at Cook County at Loyola in Chicago, and we basically were exposed to everything and anything. I have a special interest in maternal child health, so I deal with, I have training in treating women that are high risk pregnancy and international medical medicine, and participating in numerous international medical missions. So I see everything and anything, and I have seen everything and anything. But basically your usual cases of hypertension, diabetes, or obesity. And right now we're in a severe opioid epidemic. So a lot of substance abuse and the conditions that come along with that.
Yes, interesting. What is your approach to having patients with substance abuse problems? What do you do for them? Or what kinds of things?
Just like all of us are different, there's no one size fit all treatment for almost anything that you're going to treat.
Right.
There are parameters and guidelines to follow. I participate in medication assisted treatment, which can which includes, but is not limited to, buprenorphine, naloxone, medication, prescription, and outpatient therapy. So basically that's a portion of it, but again, there's not a one size fit all. So each case is on an individual basis on how I approach that patient and their treatment.
Great, absolutely. That's very important to see a person as a person rather than just a one size fits all approach. That's wonderful. And so was there anything that you particularly like to specialize in outside of that?
I think just how my personality is, it leaks over into my professional life. I get bored easily, and I like variety. So I like a little bit of everything. So I love dealing with primary care from your adolescents, from the newborns to your geriatrics. So from the babies to the millenniums to your baby boomers, I find something that I enjoy in all of them. I couldn't see myself just doing one specific age group. Okay. So I like a little bit of all of it. I like not knowing what's going to come through the door day to day. And I also like the comfort of knowing that I am going to see some things that I've seen already and following up with my patients.
Great. Wonderful. And was there anything you'd like to share about this new practice you opened in Dunkirk?
I've been fortunate to find someone who is pretty like-minded with the goals that I have. And our practice is a patient-centered practice. So we're implementing a lot of the new technologies such as telemedicine, and as well as the good old-fashioned ones like home visits. So bringing back the little black bag and the stethoscope to the homes, and then having everything right here in your fingertips for your appointment. That's it. We're a non-judgmental group. Practice is just the two of us. And again, we understand that there's not a one size fit all, and We have an individualized plan for each person, and we're both very family oriented, and we enjoy taking care of the whole family, and that plays a huge role in treatment and the dynamics of everything. So we just look forward to just doing what we enjoy the most.
Great, wonderful. I love the balance between like the future of medicine with telemedicine combined with like the old-fashioned home visits. That's awesome.
Yeah.
Great.
And it gives some diversity, so
Yeah,
we're not
that's
completely
nice.
tied down to the office. So we'll have, our
Right.
days where we're out in the community, and then, days where we are here.
Right. And that's a great way to serve a big array of different populations, because some people might not really be into telemedicine and they like the good old-fashioned home visit. So that's awesome.
And we have the space here. They can come
Great.
here.
Yes, and they can come to the office here in Dunkirk. All right, so my last question for you, which is sort of the purpose of this project, is do you have any advice or words of wisdom to someone who doesn't have access to healthcare or limited means?
That's huge especially in certain parts of our country still. I would say try to find your closest health department. They will usually be your best source to plug you in and put you in contact with other resources that can help you. Also with baseline screenings that are age appropriate, vaccinations, and just information that you may need. And again, telemedicine is huge. So there are a lot of health departments that are having clinics in their office, in the health office, and they can tele you in with a specialist or another doctor or provider that will fit your needs.
Wonderful. That's great words of wisdom for those people who have limited means or ability to reach a doctor. Great. Well, Dr. O, thank you so much for being a part of my project.
Thanks for having me.
Yes, thank you. Thanks everyone for watching. Please share this video and my future videos and spread the word about healing around the world. Thanks.